It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello again, I'm Grace Sells, and welcome back for another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really changing people's lives. We're going to get today's show started with head and neck surgeon, Dr. C.T. Nguyen.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes, and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe, and now I can. We just appreciate what Dr. Nguyen has done for my life.
Miss Richardson, wonderful woman, very busy, and she was just dizzy, and she wanted to be checked out. And we did our routine screenings of our patients where we check the heart with ultrasound, the carotids, ultrasound, aorta, legs, all of those things. But what we found was large plaque in the carotid, large plaque, and with a very abnormal velocity or blood flow.
But she sent me to have an MRI, and they found something, and so they sent me to a neurologist who ran tests and finally sent me to have a CAT scan, and found out that my carotid artery was blocked. So she sent me to St. Luke's to a Dr. Krager who put a stent in.
People will have dizziness. Sometimes there are no symptoms. So silence is not golden here. Silence is deadly. So that's why it's so important to be checked. In the literature, of course, we know that the older we are, the more oxidative stress, the more plaque formation occurs in the vessels. But I have found young people to have already atherosclerosis or plaque formation. So if we can find it at a younger age, in their 20s and 30s, that they're developing plaque, we can protect them from presenting like Ms. Richardson did, with a severe blockage that could only be fixed by surgery.
She's very personable. She has plenty of time to talk to you and tell you what the symptoms are and what can be done, and she's very caring.
Carotid disease can also present with symptoms of numbness or tingling, difficulty speaking, changes in the facial shape. Basically, people may not be able to smile, or maybe they've had small strokes where they can't move their face or speak or move their arms or legs like they used to. So those things should be checked even if they're subtle. You should check with their doctor.
When you find a doctor that you can recommend to your friends and to your family, it's great. I'm not a big fan of doctors, but I just love her to death.
To request an appointment with any of our amazing doctors, head to our website. It's bestdocsnetwork.com. Go to the doctor's profile pages and just click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's Wellness and Functional Medicine physician, Dr. Sakina Davis.
Lethargy, just tired all the time, anxious, couldn't let my mind relax, paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle, about a week or two before it happened. She would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Well, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they are socially connected.
Should you take over-the-counter cold medicines when you have a bad cold? Well, sometimes yes, and sometimes no. These medications won't kill the germs, but they will dry up the mucus that acts as the food for the germs, and then the germs die sooner. Antibiotics kill germs, but antihistamines and decongestants can dry up mucus that feeds the germs, and then they die sooner, whether you use antibiotics or not. Using nasal sprays may help. If your nose is stopped up and you can't sleep, oftentimes using one of the over-the-counter nasal sprays will help you sleep. Just don't use it more than 3 or 4 days so you don't get hooked on it. Also, antihistamines can dry up mucus, especially if it's accompanied by sneezing, like allergy symptoms. Decongestants are good too. That dries up mucus, the non-allergic type mucus, the infected type mucus. Also, some cough medicines, although they don't work very well, may make you feel a little bit better. Now, using anti-fever medications and anti-inflammatory medications for aches and pains, those will help you too and help you feel a lot better while your body fights off the germ that's causing your bad cold.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1.75 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me, and then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
Patients that I dreaded seeing previously in my practice, now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. Up next, we're going to feature podiatrist Dr. Gabriel Maislos.
First started having some pain in my right foot after an incident stepping out of a pool, and I thought it was just a simple bone bruise, but then I had some numbness, and so I went to see some podiatrists, and initially they felt it was related to my diabetes.
When he came into my office, he complained of shooting pain in his toes. So after doing an examination, an ultrasound exam, and that he exhibited signs of a neuroma. A neuroma is essentially a nerve that is compressed by the sides of the metatarsal. So the nerve courses in between, and with a neuroma, it becomes inflamed. And after a while, it develops like a fibrous sheath, and it's no longer just inflamed, it's enlarged.
In terms of quality of life, I'm a big golfer, and it was really made every day, and certainly the enjoyment of playing golf a lot less enjoyable because of the problem.
So Mr. Weber came in with the symptoms of a neuroma, and I believe I treated him a couple times with sclerosing injections. Orthotics were given to him, and as well as instructions on stretching and taking an anti-inflammatory. And he just didn't get better. So at that point, he elected to have surgery.
Well, I think certainly in my case as a diabetic, and given that the symptoms are so similar, that this could happen to other people. I wasn't even aware of what a neuroma was, and being a diabetic, so I think just awareness is a key to understanding that numbness doesn't always mean diabetic neuropathy, and it could be an actual injury to your foot, and you should see a podiatrist.
The procedure, it's very rewarding because patients like it, and there's minimal pain postoperatively. If anything, there's some temporary numbness, and then after a while, patients regain sensation. My
experience with Dr. Maislos, what I like about him is he is very circumspect. So he doesn't assume anything. Let's go through all the steps. He's really interested in finding a solution. Very pleased with the care that the doctor has given me.
Even in 2013, stress incontinence and urinary incontinence in general is a very big concern for a lot of women. Often starts with childbearing, progresses as women get older, and by late 40s, early 50s, a woman may be noticing she's leaking urine when she coughs or sneezes, when she jumps, when she exercises, or for a lot of women, the problem is that she can't sleep at night because she has to wake up and urinate frequently. If you have stress incontinence, a very simple outpatient procedure will allow you the ability to exercise without losing urine and may free you from pads and diapers that you may be wearing. But just have to talk about it. In certain other types of incontinence, may require just medications to fill.
And Dr. Imtiaz can also treat her patients with a simple and common outpatient procedure.
So for urinary stress incontinence, my most common procedure that I do is something called a transobturator tape. It's a little mesh that's placed just inside of the vagina, and it sits like a hammock around the urethra. Urethra is the little tube that you urinate out of, and in stress incontinence, the control mechanism out of the bladder is weak. A woman doesn't have the ability to control when urine comes out. When we place this little hammock at the right spot, she will be able to hold urine and be able to cough and sneeze without losing urine.
Thanks to Dr. Imtiaz and these procedures, patients no longer have to live with this very correctable problem.
Now, the interesting thing is that even in today's day and age, women aren't talking about it, and it's a very common problem. And the funny thing is, it's a fixable problem, very easy fix.
For more information on some of the best doctors in the Houston area and to watch other life-changing stories, log on to bestdocsnetwork.com.
Welcome. Today we have with us Dr. James Willerson, who's the President and Medical Director of the Texas Heart Institute. Dr. Willerson, we're so thankful that you're with us today. Welcome to our program.
Thank you.
We know that you've had a long history here in Texas with regard to the advancement of cardiovascular services. Would you tell us a little bit about the Texas Heart Institute?
The Texas Heart Institute was founded in 1962 by Dr. Denton Cooley as a research and education entity. And I think he dreamed that it would train many doctors who wanted to be heart doctors, cardiologists, surgeons, electrophysiologists, pathologists, so on, but that it would also do research, which would be important in preventing cardiovascular disease and making it easier for people to tolerate it when they already had it. And that's the way it's worked out over the last 50 plus years. It's ranked number 6 in the United States. It's been ranked in the top 10 for each of the last 22 years consecutively. There is no other heart center in Texas for which that same thing has been true. And we have educated thousands of doctors in all areas of cardiovascular disease.
I know that your great passion is teaching, and I've been able to sit at your feet and actually learn from the master, and I just thank you for that.
Thank you.
In front of the world, you are an amazing teacher.
Thank you.
And I know that you have taught many, probably thousands of students in internal medicine as well as cardiology. We want to thank you for that. And what would you tell the world about those who have that love for cardiovascular medicine and to study medicine? What would you tell those students?
Well, it is a passion, but it's based on the reflection that heart and vascular disease are the #1 killers of men, women, and children, not only in the United States, but in the world. Cancer's a distant second. For instance, as a woman, you're more likely to die of heart and vascular disease than you are of all cancers combined And as a woman, you're 5 times more likely to die of a heart attack than you are of breast cancer. And as a man, 1 out of 2.5 men worldwide will have some form of heart and vascular disease during their lives. A person dies in the United States every 26 seconds, 24/7, of heart and vascular disease.
So we want to let students know around the world to continue reaching for their passion of saving lives. And we thank you for being a leader in that, Dr.
Thank you
Willerson.
very much. You're very kind.
You are a tremendous, tremendous person. I just thank you from the bottom of my heart.
Thank you.
We have young people who are already having thickening of their heart muscle. They're already not quite having normal function. And it's the earliest signs that there's a problem there, that the heart's working against a large extra load that it normally wouldn't have to.
When I originally started to even look into this after I talked to my friend, I was probably between 335 and 340. I'd been that for 10 or 15 years, been over 300 pounds for at least 15 or 20 years.
We're giving them back some of that control in that one area where they've had a problem. But it's a dangerous area. I mean, you can't walk around at 310 pounds and think everything's going to be okay for very long. It's not.
There's been times when I'd lost weight before. I've got down to 225 before, but 6 months later, I'm back at 300, and that was always my issue. And after you do that 2 or 3 times, you know, why do you want to do it again? Because you know what's going to happen. I actually had a buddy of mine that did the surgery probably a year before I started looking into it, and he had great results. His weight loss was incredible from what I'd seen, and I'd known the guy for several years. So, and he was completely happy and excited with everything. So that's when I started looking into the surgery myself.
Buck has lost 115 pounds in about 6 months after having a sleeve gastrectomy. So I mean, that's a good outcome so far. We're only partway through. We're going to expect more weight loss beyond that, although he's clearly getting down towards his ideal body weight, which is where we'd really ideally like to have him.
I started off at 335 or 340, January of 2011, and it's February of 2012, and I'm at 186. It's like being reborn. Before, I guess I just kind of muddled through life. No excitement, just do what I had to do to get by, no energy, no fun. Now, I mean, the excitement, fun, romance, social life, things that I didn't have before. You changed my life. It's a whole new world, every day.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is, so that we can position implants within that bone and avoid the need for sinus grafting, and then subsequently lower his overall costs significantly, as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
It's satisfying to see him come back smiling, see him walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So it from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and of high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
I had a double mastectomy, and they needed to round out one of the breasts with more tissue, so they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body, and she thought, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. I feel sexy. I can wear a bikini, where I couldn't do that since 4 children ago. So, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, wanted to get back to me. I got my sexy back.
It is so great to see these doctors really making a difference in people's lives. That's going to wrap up today's show of Best Docs Network. If you have a question or comment, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thanks again for tuning in, and I'll see you next week.